Hello, I'm Dr. Alan Mercer. If you're a man over 60, I want to talk with you today about something that comes up in my office more often than you'd think, and yet almost nobody connects it to the real cause. It's not about diet, and it's not really about aging in the way most people assume. It's about what happens or doesn't happen while you're asleep. And I want to be very clear from the start. This isn't about scaring you or selling you some miracle fix. It's about understanding your own body a little better so you can make informed decisions and have a more productive conversation with your own doctor. Here's why this matters. Testosterone naturally declines with age. That part isn't a secret, and it isn't something we can simply reverse with a supplement or a trick. But what a lot of men don't realize is that certain everyday habits, especially ones tied to nighttime and sleep, can be quietly working against your hormone health in ways that go far beyond what normal aging alone would explain. I've had patients in their 60s, 70s, even 80s who assumed their low energy or low motivation was just getting older, when in fact, part of what was happening was tied to poor sleep quality, and specifically to what's called disrupted sleep architecture. That's a term we'll get into shortly. So today, I want to walk you through this the way I would with a patient sitting across from me in my office. We're going to talk about what testosterone actually does in your body, how sleep influences its production, what can go wrong at night without you even realizing it, and what realistic, sensible steps you can talk to your doctor about. I'm not here to alarm you. I'm here to inform you, the way I wish more of my own patients had been informed years before they came to see me. Let's start with the basics. Testosterone is often thought of as simply the male hormone, but its role in the body is much broader than most people assume. Yes, it's involved in libido and reproductive function, but it also plays a role in maintaining muscle mass, bone density, red blood cell production, mood regulation, and even certain aspects of cognitive function like focus and motivation. When testosterone levels are healthy for your age, you tend to feel more like yourself. When they drift lower than they should, even gradually, some men notice fatigue that doesn't improve with rest, a decline in strength despite regular activity, changes in mood, or a general sense of just not feeling as sharp as they used to. Now, here's something many people don't realize. The majority of your daily testosterone production doesn't happen throughout the day in a steady stream. It happens in pulses, and a significant portion of that pulsing activity is concentrated during sleep, particularly during specific stages of sleep. This is why sleep isn't just about feeling rested. It's actually a hormonal event. Your body uses those overnight hours to run essential maintenance, and testosterone production is part of that maintenance schedule. Let me explain this in a way that might make more sense. Think of your sleep cycle like a factory that only runs certain machines during certain shifts. During the lighter stages of sleep, your body is doing one kind of work, mostly slowing down, lowering heart rate, beginning the process of physical recovery. But as you move into deeper stages of sleep and eventually into REM sleep, which stands for rapid eye movement sleep, different systems activate. Deep sleep, sometimes called slow-wave sleep, is heavily involved in physical restoration, immune function, and importantly, hormone regulation. REM sleep, which is the stage most associated with dreaming, plays a role in cognitive processing, but it also appears to be connected to certain hormonal rhythms, including elements of the testosterone production cycle. Research has shown that testosterone levels tend to rise during sleep and peak around the time you naturally wake up in the morning, assuming your sleep cycle is intact and uninterrupted. This is why men who consistently get fragmented, shallow, or insufficient sleep often show lower morning testosterone levels compared to men of the same age who sleep more soundly. It's not that sleep instantly creates testosterone out of nowhere. It's that consistent, quality sleep provides the physiological window in which your body does what it's supposed to do naturally. So now let's talk about the nighttime mistake that so many men over 60 are making, often without knowing it. And I want to be fair here, it's rarely just one single mistake. It's usually a combination of habits that stack up over time. But if I had to point to the most common and most overlooked factor I see in my own practice, it would be chronic, undiagnosed poor sleep quality, frequently caused or worsened by something called obstructive sleep apnea. Let me tell you about a patient I'll call Robert, not his real name, of course. Robert was 68 years old, active, watched his diet reasonably well, and couldn't understand why he felt tired all the time despite going to bed at a reasonable hour every night. His wife had mentioned his snoring for years, but he brushed it off the way a lot of men do. When we eventually ran a sleep study, it turned out Robert had moderate sleep apnea, meaning his airway was partially collapsing multiple times per hour throughout the night, causing brief awakenings he wasn't even consciously aware of. His body was never getting into those deeper stages of sleep long enough or often enough. After being treated for his sleep apnea under his doctor's guidance, Robert didn't become a different person overnight, but over time, his energy levels improved, and follow-up testing showed some improvement in his hormone levels as well. I want to be careful here. This isn't a guarantee for every patient, and sleep apnea treatment is not a testosterone treatment. But it illustrates how interconnected these systems really are. Sleep apnea is incredibly common in men over 60, and it's especially common in men who carry extra weight around the midsection, though it can occur in men of any body type. The mechanism here is fairly straightforward once you understand it. When your airway is repeatedly obstructed during the night, your oxygen levels drop periodically. Your body responds with brief arousals to reopen the airway, even if you don't fully wake up, and this fragments your sleep cycle before you can spend enough time in the deeper restorative stages. Over months and years, this pattern is associated with a number of health concerns, including cardiovascular strain, and yes, research has also linked sleep apnea to lower testosterone levels in men. Now, if you're listening to this and thinking, I don't snore, so this doesn't apply to me, I'd gently push back on that assumption. Not everyone with sleep apnea snores loudly, and not everyone who snores has sleep apnea. If you wake up feeling unrefreshed most mornings, if you experience daytime fatigue despite adequate time in bed, or if your partner has mentioned pauses in your breathing at night, that's worth bringing up with your physician. A simple conversation can lead to a sleep study, which is a straightforward, non-invasive way to get real answers. But that's only part of the story. Let's talk about another factor that ties in closely with sleep and hormone health, and that's body weight, specifically excess fat tissue, particularly around the abdomen. Here's something that surprises a lot of my patients. Fat tissue isn't just passive storage. It's metabolically active, and it actually produces an enzyme called aromatase, which converts testosterone into estrogen. This means that as body fat increases, especially visceral fat around the organs, testosterone can be converted into estrogen at a higher rate, which lowers the amount of active testosterone circulating in your body. This creates a bit of a frustrating cycle for some men, because lower testosterone can make it harder to build and maintain muscle, and lower muscle mass can make weight management more difficult, which can further impact hormone balance. It's not a moral failing, it's simply biology, and understanding it is the first step toward addressing it constructively with your doctor. Now let's talk about another common reason this issue gets overlooked, and that's chronic stress and the hormone cortisol. Cortisol is often called the stress hormone, and it plays an essential role in your body's normal functioning. In short bursts, it's incredibly useful. It helps you respond to challenges, wakes you up in the morning, and helps regulate blood sugar and blood pressure. But when cortisol remains elevated for long periods, whether due to work stress, financial worry, caregiving responsibilities, or simply the accumulated pressures of daily life, it can interfere with the same hormonal pathways that regulate testosterone production. Chronically elevated cortisol has been associated with lower testosterone levels in multiple studies, and it also happens to interfere with sleep quality, which brings us right back to the nighttime connection we discussed earlier. I had a patient, I'll call him Gerald, 72 years old, recently retired, who found that even without a traditional job, he was more stressed than ever, largely due to caregiving responsibilities for his spouse. He wasn't sleeping well. He described feeling wired but tired most evenings, and his lab work showed a pattern consistent with elevated cortisol and lower than expected testosterone for his age. We didn't fix this with a pill. We worked on stress management strategies, adjusted his evening routine, and over time, with his physician's guidance, some of these markers improved. Again, I want to stress, results vary for every individual, and this isn't a promise of a specific outcome, but it demonstrates how stress, sleep, and hormone health are all woven together. Now, alcohol is something I want to address directly because I know it's a sensitive topic for a lot of men, especially those who enjoy a drink or two in the evening as a way to relax and wind down. Here's something many people don't realize. While alcohol might make you feel drowsy and help you fall asleep faster, it actually disrupts the quality of your sleep later in the night. Alcohol suppresses REM sleep in the first half of the night, and then as it metabolizes, it can cause fragmented, lighter sleep in the second half, along with more frequent awakenings. This means that even if you're getting 7 or 8 hours in bed, the quality of that sleep may be significantly reduced on nights when alcohol is involved. And since we already know that deep sleep and REM sleep are tied to hormone regulation, regular alcohol use close to bedtime can be one of those quiet contributors to lower testosterone levels over time. I'm not telling you that you can never enjoy a drink. I'm simply saying this is worth being aware of, and if you notice a pattern of poor sleep on nights you drink, that's useful information to share with your doctor. Let's also talk about medications, because this is an area where I always encourage patients to have an open conversation with their prescribing physician rather than making changes on their own. Certain medications, including some used for blood pressure, some corticosteroids, some opioid pain medications, and certain medications for prostate conditions, have been associated with changes in testosterone levels. I want to be very clear here. I am never suggesting anyone stop or adjust a prescribed medication without medical guidance. These medications are often prescribed for very important reasons, and the benefits frequently outweigh the risks. But if you're concerned about your hormone levels, it's absolutely reasonable to ask your doctor whether any of your current medications could be a contributing factor and whether there are alternatives or adjustments worth discussing. Diabetes and blood sugar regulation are another piece of this puzzle. Men with type 2 diabetes, particularly when blood sugar is poorly controlled, have a higher likelihood of also having lower testosterone levels. The relationship appears to go both directions to some degree, meaning blood sugar issues can influence hormone levels, and hormone levels can influence blood sugar regulation and body composition. This is yet another reason why routine blood work and regular checkups become increasingly valuable as we get older. If you haven't had your blood sugar checked recently, or if it's been a while since your last comprehensive physical, that's a very reasonable thing to schedule. Now, of course, we do have to talk honestly about aging itself. Testosterone levels naturally decline gradually starting around age 30, and this continues gradually through the decades. By the time a man reaches his 60s, 70s, or 80s, some decline compared to his 20s is completely normal and expected. This is not a disease. It's a natural part of the aging process, similar to how many other physiological functions gradually shift over time. The goal here isn't to chase the hormone levels of a 25-year-old. The goal is to make sure that any additional, avoidable factors, like poor sleep, excess weight, chronic stress, or lifestyle habits, aren't accelerating that decline more than necessary, and that your levels are appropriate and healthy for your age and overall health picture. Many of my patients are surprised to learn just how much regular physical activity influences this whole picture, and not necessarily in the way they expect. It's not about extreme workouts or trying to train like a much younger man. Research has shown that resistance training, meaning activities that involve working your muscles against resistance, like weights, resistance bands, or even bodyweight exercises, is associated with healthier testosterone levels in aging men, more so than pure cardiovascular exercise alone, though cardiovascular exercise remains important for heart health and overall well-being. Movement also improves sleep quality, helps with weight management, and reduces stress. So in many ways, exercise touches nearly every factor we've already discussed today. I think of a patient named Walter, 75 years old, who started with very modest resistance exercises, nothing dramatic, just 2 sessions a week using light resistance bands and body weight movements under the guidance of a physical therapist due to some prior joint concerns. Over several months, Walter reported better sleep, improved mood, and more stable energy throughout the day. His follow-up labs showed some favorable changes as well. I always tell my patients, results like this vary significantly from person to person, and Walter's experience isn't a promise of what everyone will experience, but it does show that gentle, consistent movement, appropriate for your individual health status, can be part of a meaningful overall approach. Nutrition also plays a supporting role here, though I want to steer away from any specific miracle food claims because, frankly, those claims tend to oversimplify something that's genuinely complex. What the evidence does support is that a generally balanced diet, adequate protein intake to support muscle maintenance, healthy fats, particularly from sources like olive oil, fish, nuts, and avoiding excessive processed sugar and highly processed foods, is associated with better metabolic health overall, which indirectly supports hormone balance. Vitamin D and zinc are 2 nutrients that have been studied in relation to testosterone, and deficiencies in either have been associated with lower levels in some studies. This is exactly the kind of thing worth discussing with your doctor, who can check your levels through blood work rather than guessing or relying on supplements without knowing whether you actually need them. So let's bring this all together and talk about realistic, sensible steps. I always tell my patients, we're not looking for a dramatic overnight transformation. We're looking for small, sustainable adjustments that add up over time. That might mean setting a more consistent bedtime and wake time, even on weekends, since irregular sleep schedules can disrupt your natural hormone rhythms. It might mean creating a wind-down routine in the evening, dimming lights, stepping away from screens, and giving your body time to naturally prepare for sleep rather than going from high stimulation straight into bed. It might mean being mindful of alcohol timing, perhaps having that drink earlier in the evening rather than right before bed, or reducing frequency if you notice it's affecting your sleep. It might mean incorporating some form of regular resistance-based movement, appropriate for your current fitness level and cleared by your doctor, especially if you have any existing joint or cardiovascular concerns. And it might mean simply becoming more aware of your snoring patterns, your daytime energy levels, and bringing those observations to your next physical. Now, I want to talk about when it's time to actually see your physician about this because I don't want anyone listening to this to simply try to manage a real medical concern entirely on their own. If you're experiencing persistent fatigue that doesn't improve with adequate rest, noticeable changes in mood or motivation, unexplained changes in muscle mass or body composition, ongoing sleep disturbances, loud snoring with witnessed pauses in breathing, or any other symptoms that concern you, these are all excellent reasons to schedule an appointment. Your doctor can order appropriate blood work, which typically includes measuring total and sometimes free testosterone levels, and can evaluate other factors like thyroid function, blood sugar, and overall metabolic health, since many of these systems overlap and influence each other. I also want to mention testosterone replacement therapy exists and can be appropriate for certain men with clinically diagnosed low testosterone, but it's not something that should be pursued casually or without proper medical evaluation. It carries its own considerations and potential risks that need to be weighed carefully with your physician based on your individual health history. My goal today isn't to tell you that you need this treatment. It's to help you understand the broader picture so that if you do have a conversation with your doctor, you're going in informed and ready to ask the right questions. I also want to address something I hear frequently in my office, which is a sense of embarrassment or reluctance to bring up these topics at all. I want to reassure you, these are incredibly common concerns, and any good physician has had this conversation many, many times before. There's nothing to feel awkward about. Your health, your energy, and your quality of life matter, and these conversations are a normal, healthy part of aging responsibly, rather than ignoring changes and hoping they resolve on their own. There's one more important factor I want to mention before we wrap up, and that's simply the value of patience and consistency. So much of what we've talked about today, sleep quality, stress management, weight management, exercise, nutrition, these aren't quick fixes. They're gradual, ongoing practices that support your overall health over months and years, not overnight. I always encourage my patients to think of this less like flipping a switch and more like slowly turning a large ship in a new direction. The changes are gradual, but they add up meaningfully over time, especially when paired with regular medical checkups to track your progress and adjust your approach as needed. I also want to gently remind you, everything we've discussed today is general health education, and it's not a substitute for a personalized evaluation from your own physician who knows your complete medical history. Every man's situation is different, and what applies to one patient may not apply directly to another. If anything in today's discussion resonated with you, I genuinely encourage you to bring it up at your next appointment, or schedule one if it's been a while. So, to summarize everything we've covered today, testosterone plays a much broader role in your health than most people realize. Sleep quality, particularly deep sleep and REM sleep, plays a meaningful role in healthy hormone production, and there are several everyday factors, including sleep apnea, excess weight, chronic stress, alcohol use, certain medications, blood sugar regulation, and natural aging that can all influence your testosterone levels in different ways. The encouraging part of all this is that many of these factors are within your ability to influence through sensible, gradual lifestyle adjustments, always in partnership with your physician rather than as a replacement for proper medical care. I hope today's discussion gave you a clearer, more complete picture of something that affects so many men but gets talked about so rarely in an honest, balanced way. If you found this helpful, I'd really appreciate it if you'd consider subscribing to the channel, since we cover topics like this regularly, all aimed at helping men over 60 take a more informed, proactive approach to their health. And I always welcome your comments and questions below. I read them, and many future topics actually come directly from what you all bring up, so please feel free to share your thoughts or your own experiences respectfully in the comments. Take care of yourself, keep an open line of communication with your doctor, and remember that small, consistent steps really can make a meaningful difference over time. I'm Dr. Alan Mercer. Thank you for watching, and I'll see you in the next video.